All right. Good afternoon, once more, team. I believe we can start because of time. We are exactly 10 minutes past 2. I think that indicated that we could purpose to begin at 10 minutes past 2. So let me take this opportunity to welcome all of us into our fourth series of virtual trainings that we've lined up for you. I think we mentioned previously that the main objective of this virtual trainings is just to build the capacity of all of us, be it at the facility level, sub-county level, partner level, leadership level, or at the county level, to build your capacity to be able to navigate and, of course, utilize or scale up use of KenyaEMR 3.3.x. So I want to request a volunteer to pray for us. I know a few of us have the mic. I want to request Frida. I don't know whether Frida is in. You can lead us in a word of prayer before we begin. Frida or Yujo?
Hi, Sangok. Yes, I am. Let's pray. Almighty and everlasting Father, thank you for allowing us to be here today, to be able to attend this training and to be able to learn. As we want to start, we ask you to give us the power to be able to understand what you're going to be taught today regarding the new features in KenyaEMR, and to be able to enable us also to take whatever we've learned and be able to implement successfully in the different facilities. Give us understanding. We pray this believing and trusting in Jesus' name. Amen.
Amen. And thank you very much, Frida, for leading us in word of prayer. So this virtual training has been organized in collaboration with the Ministry of Health, of course, through NASCOP, and all our HIS partners, including the service delivery partners, all the county teams. And we really appreciate and acknowledge the support this far that we've been receiving from all the team members, all the players in the HIS space. Like I'd mentioned earlier, today our main focus will be to help you understand or just appreciate some of the features that we have in KenyaEMR 3.x, and our main theme is to help you navigate KenyaEMR 3.x with confidence, if I may say so. Some few housekeeping matters. We have the chat box. If you have any questions, kindly utilize the chat box. We have a team who would be very much available to respond to any of the questions. At the end of the call, again, we will have a session to allow you to ask any questions that probably you may not have been answered. So we'll give you an opportunity to just verbalize any questions that you may have before the end of the call. But we would encourage that we utilize the chat to ask your questions. You also note that we have deliberately muted everyone so that to just provide some ample time to the facilitators. But however, that doesn't mean that you're not allowed to ask any questions. So we will request that when that time comes, you raise your hand, and we'll give you the rights to be able to unmute and speak and ask your questions. Right. So at this point, I want to share with you our agenda for the day. So just give me a minute to share the agenda. Sorry. Yeah. Just give me a second. Okay. Yeah. Somebody confirm that you can see the agenda. Frida, confirm you can see the agenda.
It's coming up, not yet. Yes, I can see the agenda now.
All right, thank you. Yeah, so this is our agenda for the day. Our objective basically is to help you learn the importance of the features of which are in KenyaEMR3.x, and of course one of the new features is how to update a patient profile. We should be able to also help you to easily handle patient appointments and service queue steps in the KenyaEMR3.x system. And of course, finally, to also be able to help you understand the special functions and processes in KenyaEMR3.x through a demo. So, so this is our agenda. I think I'll just quickly run you through the first parts or the parts of the sections that we'll be able to cover today. So Ajuang Bernard from Palladium will take us through the first part, which is a slide deck. Just helping us just understand as part of an introduction to KenyaEMR3.x new features. And then Ajuang will also take us through the first part of the presentation, just looking at the general overview, the patient search and registration, how do you navigate and how do you search for a client or a patient within the system. He'll be able to also show us some of the improved patient profile. He'll also be able to share with us the clinical menu and also how to access special clinics and the care panel. Moses will also wrap that up, the demo part, focusing majorly on the special features, that is service queues, appointment management, the patient referral, the new user management, and the ETL process. This is for purposes of reporting. And then after that, we'll then open it up for Q&A, and then we close. However, like I said earlier, if you have any questions during the presentations, you can always raise your hand. And I mean, at the end of the presentations, we'll give you an opportunity to raise your hand. But during the presentations, please post your questions on the chat. At this point, I don't know whether I want to request that we receive some remarks from a few colleagues who are in here. I don't know whether we have Jojo Wiso or Dr. Jacob from Palladium or Diana. I don't know anyone in the call. We can, any of the three who is in the call can probably just give us some opening remarks before we begin. Can you kindly confirm if either Diana, Dr. Jacob, or George is in the call? Okay, so if not, then we can proceed. I don't know, do we have anyone from CDC, KDOD, or USID? Maybe one person if they're in the call. You can raise your hand so that we can give you the mic. Yeah. Yeah, I think I'd seen some colleagues from the county. I'd seen, I think, Florence Casco. I don't know whether there was another Casco in the call. Any Casco in the call, you can raise your hand. We'll give you the mic to make some remarks before we begin. Let me stop. I can see. Okay, I'm not seeing any hand up. All right, I think we can continue and probably allow them to speak before the close of our training, just in case they'll have joined. So at this point, allow me to welcome Bernard Ajuang, who will take us through the first part, which is a presentation, which basically will just be focusing on an introduction to the KenyaEMR3.x new features. Ajuang, once you're done, you can also go straight to the demo. Once this will take us through the last part, then I'll come in to moderate the Q&A session. So thank you from my end, and over to you, Bernard Ajuang.
Songok, there is a hand up before we begin. There's CHRIO for KK.
You can allow Mike to speak. Mike, you have the mic now. You can unmute and speak. I'm assuming that is Mike Ruto. Mike Ruto, you have the mic now. Go ahead. Unmute and speak kindly. All right, it seems we could be having challenges with the mic. So maybe, Ajwang, we can proceed, and then we will probably give him an opportunity to speak before we close. Over to you, Ajwang.
All right. Thanks, Songok, and welcome everyone to our fourth session on this training series. So today our focus will be on patient management using KenyaEMR3.x. We'll talk you through some of the improved features and services that are currently facilitating patient-centered care. Previously, we've looked at some of the new and improved modules, but today we focus back on clinical management of the patient. So allow me to take you through a very short presentation, after which we'll then go into the demo. Okay. So our objectives today is basically to just learn about the new features that have been improved in 3.x that will facilitate patient clinical management. So we will be focusing on some specific areas. We will look at the new patient search and registration process. We will look at the improved patient profile features. We'll also take you through how you can handle appointment management for the patients, and also we'll take a walkthrough of the service queue process. I will also cover some of the specialized clinics that have been included in the system right now, as well as enrollment into special programs for our clients. We'll also, at the tail end, look at how you can do referrals and also how you can administer users straight from the 3.x interface. So as we step back to look at where we are with regard to KenyaEMR implementations, and currently we have some 2,558 sites, of which the active sites are as given 2470, which means about 100 or so facilities are not active as at this point. And in terms of TXCAR, we are covering 1.1 million Kenyans, and this is for HIV cover. And in terms of facility-wide use of the system beyond HIV, we are in some 173 facilities that are actively utilizing the facility-wide modules. So as we look at some of the features that we'll be talking about today, we want to just discuss some of the value propositions for a number of these features. First of all, we have an improved user interface. As you will see shortly, we have improved the user interface to make a number of features and client menus directly available. So what that means is, as a clinician, for example, all the essential information is always in front of you at the start. This was a feature that, of course, was pioneered in the very early days of 3.x, and that helps clinicians to make decisions better and also avoid any errors. We've improved the queue manager. This is one of those early features, again, modules that was done in 3.x. It's been improved so that it can help you, of course, streamline patient flows and reduce wait times by your clients. So all the way from checking in, you can actually track which department is handing off clients at what point, who is taking longer with the clients. And of course, there is also analytics available in terms of wait times and quality service provision. In terms of navigation, The front-end design components now make it much more easier to visually focus your attention on the patient relevant menus, as you will see shortly. This is, of course, a design that came with 3.x as well. Appointment manager has also been improved so that now you can easily look at scheduled visits and centrally manage your clinic workload, not just for HIV or TB clients, but also for other clients who have to make routine visits to the facilities. And at the same time, as you will see shortly, we've expanded the number of special clinics that are available to help you cater to your clients. As we continue the care panel as well, the value proposition we are looking at here is that now we are able to not only just enroll and discontinue clients from the special programs like HIV and TB, but now we are able to enroll them into other programs as well, like NCDs and so on, as you will see. At the same time, the care panel will be able to track for you and make any applicable ML predictions for the client that you'll be looking at as a clinician. Patient search, you will see how that has now been linked directly to support patient search and retrieval from the SHA. At the same time, the referrals module has been revamped, as you will be seeing in the demo that will be coming up shortly. Last but not least, we will look at a user administration and ETL that has now been brought onto the 3.x interface away from the 2.x side. So as you'll see shortly, this is the centerpiece of this new design. The client is always at the center, as you can tell. This is a typical client chart that gives you the salient information that you need about the client and enables you to directly interact and action on the appropriate menus. Now, that client profile will keep changing depending on what service you are offering. So for example, if it's a client who is gone into some specialized clinic, as you can see over here for MOPC form and so on, you'll be able to directly interact and get the relevant tools that applies to these specialized clinics. That will then enable you not only to just use the old generic clinical encounter form. So we've got a number of specialized clinics, as you can see on the screen, and our belief is that this has covered literally all the specialized clinics that currently are in use in the public hospitals. So in terms of specialized modules, that is in terms of services we are offering or catering to, these have been improved away from the old outpatient and the inpatient and the standard lab, pharmacy, billing, stock, all of which we've looked at previously. There are additional ones like morgue that are incoming and radiology, among others. Something else, I know this had been previously mentioned. So again, as you manage your clients, you'll also be able to see a number of dashboards that is relevant, whether it's on visits, whether it's on outpatient performance and so on. It could be on workload and so on and so forth. So that, in a sense, is what we're going to look at today. As always, we appreciate the support and collaboration from the Ministry of Health, the CHMTs, the agencies, our SDPs, and of course other HIS partner for this. So we'll now transition to a demo. So at this point, allow me to just stop sharing as I switch to another instance to take us through the next steps. Right. I believe you can see my screen. So as usual, once you log into KenyaEMR, we know the login process. You will land at the homepage, and the homepage currently is as shown before you. We just want to point out a few features that have been enhanced. As you can see, a number of the menus on the left hand, that is the navigation menu, have been consolidated so that, for instance, now appointment and service queues is located under patient services. We've got the two new modules: mortuary ward management, claims management, linkage services, billing, and diagnostics. Another thing I want to just point out is diagnostics, which incorporates for us imaging and radiology, procedures, lab, and also lab manifest services is now consolidated on that side. And on the toolbar at the top, again, we still retain the same old design. Search is at the center of everything else, and we've got the KenyaEMR modules, the typical ones that you know about. A few additions there, as will be shown by Moses, and of course, the ability to log in and change your login location and so on. And of course, at the very end here, you can always create a new patient. So that is the interface. As you will see shortly, this interface changes in context once you have a patient search, patient profile before you. So my next step is I would like to go straight and show how the new search features works. As always, when you click on search, you will get a number of records that you previously had searched for in the cache. Those will be delayed. Those will be displayed before you. But what we expect is that in the new system with the SHA integration, the primary searching parameter will be the ID number for the client who will present before you. So just allow me to use this particular number for this friend of mine. So you will record the number in the search box. So what you will see before you is, if this client has never been to your facility before, this is what you will get. And because we are searching on this number, we are prompted to just confirm what type of identifier we are using. In our case, we will say this is a national identifier, at which point the system will look this up. Sorry, no patient. Just a moment. This my valid. Okay. All right. I think I twisted. Okay, so this is 21.6. All right. So that is a good learning process. If the patient has never registered with the SHA as well, that is what the first instance is what you will get. You will get confirmation that this guy doesn't exist. But if the client has a valid SHA registration, then this is what you expect to get before you. So what is likely to happen is, as you can tell over here, it confirms that these details have been pushed through the HIE pipe, and therefore you should be able to like confirm a few other information about this client, like who are the dependents. The good thing is a number of the details are actually masked, so you don't need to worry about that. Your next step would be to perform an OTP verification so that you'd be able to confirm the details and start services. So what typically would happen is at this point, you will confirm the phone that the system has about this client. And at that point, you would select request one-time password. Once you verify the phone number, at which point then the client before you will then read back to you that OTP that they will have received. Then you will record that here at the box and then continue to the patient chat. So that is what is likely to happen for you. In our case, we are not connected to a live instance of SHA. We are using a test environment to replicate this particular scenario. And so I do not wish to go ahead and send this OTP. So that is typically the first case, the first scenario that is likely to happen when the client presents before you and you want to confirm, pull their details, confirm them, and then go ahead and treat them. The other alternative way is, of course, you can not only find someone who you probably would also want a client who has previously come to your facility but doesn't have like a SHA. So this is another scenario. If I search for my patient whom I just created before this demo, you can tell the system will automatically find the details of my client here. But in that instance, now you see there is no prompt for the SHA. And you then proceed and check in the client and move in to provide the services as always. So I'll just go ahead and confirm the details of my client, and then at which point then I'll move on and offer the services. So allow me to just switch to another instance. Right. So assuming you search for your client and you have the patient search before you, like I said, I've just switched back from the HIE instance, test instance, and now I'm focusing more on, I think this is the same version that you guys have. Once you'll have searched and brought the patient profile before you, one of the things we want to highlight is that there are a number of additional changes here. Previously, you were being prompted to check in the client, but right now when you search for the client, you'll be required to add a visit. So this is what you're likely to find, and you'll notice that there are additional menus here. You can add a visit and also end an active visit. So that again correlates to check-in and check-out, the same way we had that particular use case before. The others remain the same. You can always edit the patient details, and also you can mark the patient as deceased. As always, because the patient is already checked in, you could always go ahead and change the service point for them, confirming what service queue they are on, status, or the priority, and anything else regarding their visit. So those are some of the slight changes that have come through for this particular, with this incoming version for us. Okay. Next, I want to focus on the clinical management itself. Assuming the patient has been checked in, like mine has been checked in here, one of the things that you'll notice will have changed is orders. Again, the orders will be listed for you in a straight line, in a tabular format. I believe this is the same format that we've had since 19.13, so not much changes there. What has changed is on the results page. So you'll always find that one of the things that you can tell is that you have results over time, and you also have individual test results on the card. Unfortunately, I don't seem to have much data on this client profile. I'll see what I can do about that. Yeah. In addition, we still retain the standard features. On the right-hand side, we've got the toolbox, the order, the visit note for the clients, and of course the clinical forms that they can select and use at any one time. The clinical encounter on this other side is also available as well. One other thing I would like to just point out before I move on is that now we've got a visit tab here that gives us basically a summary of the visits by the patient, what services they came for, maybe outpatient, inpatient, and so on. And the difference is that now you can display that either in a compact table form, or you can show that as a summary of cards as we are seeing right now. Let me just refresh that. I don't know why my card is looking like my tables. Okay. I think my card is acting up. But what we expect is we should be getting a compact list of these visits or encounters, and also a summary cards, as you can see before you. Okay. All right. So assuming as a clinician now you've done the basic clinical encounter, you'll have recorded the vitals, you'll have done the initial clinical encounter or made a clinical order. The next feature that I would like to show you is the availability of this feature that enables us now to enroll, of course, to other programs as well. And now it should be possible for you to enroll directly into a different service area. Say in this instance, I want to enroll this guy into an NCD program. One of the things that will happen is that directly a visit enrollment card is opened for me. You'll go through the routine, confirm if it's your first visit, just move through the normal clinical encounter and so on. The difference here, as you'll notice, is that patient history is now tailored towards the NCD program. So as you can tell, you confirm the complaints. The complaints are directly related to the NCDs. When you're looking at the disease type, again, they are directly relating to the NCDs that we are covering, like diabetes and hypertension and so on. So as you can see, you then go ahead and complete this form, make the typical examinations, and then complete your patient management for that particular day, and then save that particular encounter and then move on. So I'll just want to discard that form. So as always, once you are enrolled into a service area, you have the option to easily exit and discontinue that program as and when the time comes. So that is the care program. The basic thing, as you can tell, is the addition of other programs that are non-HIV related. I'd want to then take a final stab at the special clinics that have been included in the system right now. As I pointed out in the demo, we've got literally all the special clinics available. for you, for the public sector. And as always, selecting a special clinic with the user profile, with the client profile on, you'll be prompted directly to directly go and record a clinic visit, in this case, medical ward visit. And this is what would then happen. We will then be prompted to make some specific recordings that directly relate to this particular clinic. You can see before you, we've got confirmation whether it's a new or a return visit, or it's a transfer from one ward to another. Confirmation if it's been a referral from another physician, and then you then go on and complete the rest of these details that is only relevant to the MOPC clinic. So that is a way in which right now, if a clinician, if a physician is seeing a client at these special clinics, they will be able to access and use the specific tools and do the assessment, gather the history and management of that patient using the tools that are just directly relevant to that patient at that point in time. So I don't want to go into completing this form, but basically that is what we have. And the patient journey. So our patient will have been registered. We'll have searched for him first of all. And if they're not present, then we can go ahead and register them, start a visit, take them to the clinician for general clinical management, walk them to a special program, see them at a special clinic on that day, if that is one of the reasons that they are visiting. So I wanted to just point out some of the new features, a little bit of some additions that is coming through to support patient registration for you. So this is a familiar interface. You have the basic info for the client, and then the identifiers. One of the things you want to point out is that with the integration with the SHA, now we've got additional identifiers, which is the SHIF number, we've got the SHA number, and of course patient clinic, if that is applicable for you. And if at your facility you use additional identifiers, then you can go ahead and select these additional identifiers and configure them for your instance. So as you can tell, the ones that are already grayed out are the defaults that are in use. OpenMRS ID, birth certificate was on the other side, DL was on the other side, and so on. So in the event, for example, at your facility, you have a number of OVCs that you're monitoring, and you've got the details from their CPMIS numbers. You can go ahead and select that as an additional identifier. In the event, for example, again, say you are at a site that caters to the armed services, then you again go ahead and select a DoD number in there. At the same time, we've got options for recency testing ID and a number of other IDs that would be applicable. So this is something that probably, depending on where you are, if you're at a border, for example, you could identify and select the cross-border IDs to be in use to support you seeing the patients. District registration number, which I believe was in use for people who are registered as TB clients. So that is it. You then go ahead and just configure the clients, at which point those additional identifiers would come up on your system. So allow me to stop at this point and welcome my colleague Moses to take us through the next session. Back to you.
Thank you, John. Please
Songok.
confirm that you can hear me.
Yes, yes.
Even as you unshare your screen. Asante. Thank you. Thank you, everyone. Good afternoon. My name is Moses Kerr. I'm a health informatics specialist working with the KenyaEMR project. So I'll be here to just pick up from where my colleague Ajuang has left, and he has laid for me a very good platform just to be able to proceed. So I'll be sharing my screen. Please confirm that my screen is visible. I'm bado inakuja.
It's feasible. It's feasible. Can go ahead.
I can proceed. Thank you, Franklin. Well, my task here will be very brief. One, because I'm supposed to just take you through the service queue and show you the features, and then the appointment management, some bit of patient referral, and also induct you on the new user management that has been included in 3.x, including the place where you'll find all the ETL processes. So allow me to just pick up from where Ajuang left, and he has laid a very good background for me. I saw a hand up, but Songoki, if you want to guide me, I hope we can take the questions at the end of the presentation. But still encourage our participants to just drop their concerns or any queries they have on chat. All right. So service queues. So when you log into your KenyaEMR, I mean, this is usually the home page. This is actually is your landing page, and to some they might confuse this for the service queue. This is not the service queue. Actually, this is the active visits. Just a line list of the active visits that are the facilities is having. But where do we find the service queues? And like Ajuang has pointed out, we've really our team has really tried to just declutter the EMR, make things available easily, and just lump them in associated features and buttons. So for purposes of our demo today, service queues, you will find them under the patient services. So there's a cluster called the patient services that was coined, and under it you'll find the service queues, appointments, which is the other thing that I'll be looking at, and then I think the two. So, but allow me to just dive deep to service queues. So when you click on service queues, I mean, again, what you get is this very good dashboard, actually with the clinic metrics, and your clinic metrics will actually give you at a snapshot details about statistics about the visits that are ongoing in the facility, including clients that have been checked in. Like for my case here, you can see there are about 5 clients that have been checked in, and then those that are waiting. For this case, there was one patient that is waiting for service, and then at the end of the day, again, when you look at the far right of my screen, there's the average waiting time today. This only comes in play after we've checked out all the patients that came, and then now it's more of use to the managers, because it gives them the average waiting time for a specific day, and I'm sure this is good information that can be utilized in helping probably in resolving workload issues and stuff like that. So yeah. So that is as far as the service, actually as the clinic metrics are concerned. Other than that, there's also this feature here. I'll skip the queue screen, but just besides it, there is a drop-down arrow, and you'll realize that it opens up a menu for you. Again, this is where the facility is actually enables the facility to be able just to configure, let's say add a new service. You remember, the EMR comes to you as a blank slate, but you're supposed to customize it to suit the clinic flow and the patient flow in your various facilities. So if probably you have 2 clinical consultation room, this is where you come and add them from, and by just clicking add new service, it gives you that window. And for example, for my case, I might just say clinical consultation room 3, assuming that you already have 2 in place. Consultation room 3. The facility has grown, and there is a need for an additional clinical consultation room. And then I'll come and choose the type of service. Most of the time, this is just clinical consultation. So I'll just pick it from the drop-down list. And then now select whether it is in OPD or any of those other areas that have been mapped. And then I just save. So that is what you can do from that particular menu item. Other than that, you can also add a new service room, just like I did, following the same process that I did, and also add a provider queue room. So all that is available there. And then if you look down now, there's the patients currently in queue. There's this bit here, just beside below the add patient to queue, because I'll be talking about. I'm sure that speaks to itself. You can that is one area that you can add a patient to the queue, but I'll be talking about it and also show you the other two areas where you can add a patient to a queue. But when you look at these now and use these filters on waiting, for example, if I'm to choose on clinical consultation, you'll see that I have one patient waiting. And if I am to choose, let's say, triage, there's no patient queuing in triage. So this is where now our care providers usually go to now, based on the services that they're manning or where they're offering service, to just drill down to the specific queues that they should attend to. If I had like 10 patients here, you'll have seen probably triage has 5 and probably clinical consultation has 2. But as it is currently, the numbers are there's only one patient in queue, and that patient is currently queuing at clinical consultation. All right, like I mentioned again, you can add a patient to the queue using that button, but allow me to also introduce you to the features below the currently in queue menu. So one other thing that you're able to see is that you're able to see the patient name, you're able to see the queue number, and even where they're coming from, if that has been listed. And then also the priority. Priority is what actually determines whether the patient will be queued on top or below the rest. So if they are an emergency, I'll be showcasing that when I'll be trying to just add a patient to the queue. They will always come at the top of the queue. And then now the status, like for my case, this one is waiting. And where are they waiting? They are waiting for at the clinical consultation, the CCC. And they have been there and you can also see that there's a waiting time. They have been there for 4 hours and 24 minutes, so which is quite a long time. So if I'm to serve them, there's this bell button here. Looks like a bell. So the bell is just a call to action. So we ring the bell to call you to action. So when I click on it, it allows me to serve that particular patient. So I get them I call them. Probably if they are seated outside the room, I should be able to call them. But other than just calling, there was under the queue screen. I'll take you back there again. If you can configure your facility, you should be able to broadcast the patient based on the tokens they have picked from the queuing system. You should be able to broadcast their numbers, and they will know that you've just called them to be attended to, just like it is in the bank. And for information, one of the things that were the version 19.1.3 didn't have was the voice prompt. But with configuration, this one can also give you voice prompts, just like it is in the bank, where you are sometimes told ticket number 353, please go to for now, but ours now it won't ask you to go to teller number 3, but ask you to go to clinical consultation room 3 or to go to triage or something like that. So that has already been achieved. But all you need to do is to do some configuration again, like I stated, and get probably a voice, a public address system that will help broadcast that to the patient. So once I get them here, I mean, I can offer them a service if I want to offer them a clinical and open a clinical encounter for them. I think that has been covered in the previous sessions that we've had. But for the purposes of this, I'll just also want to show you that once I'm done with them again and I want them to probably go to another queue, I'll just come up here and change. So as is currently, they are in clinical consultation, CCC, and I'll want to move them to a new area now. Let's say I want to send them to lab. So I want to send them to lab. Let's say we have a lab service called lab service CCC. So, and I'll want them to be waiting there because I'm finished with them. And like I said again, the queue priority, it can either be an emergency, not urgent, or urgent. So emergency supersedes urgent, and then not urgent is just the normal one. So I'll just want to transition them there, and yeah. So my patient has been moved from now clinical consultation to the lab. So that is the other area. That is the second place where you can move a patient within the queues. The other one, of course, is the typical one, where the one that you know that when a patient walks into the clinic, the first thing we do is to, add a visit. Mine is already in a visit, but when you are adding your visit, there's this place down here where you're supposed to specify the queue location. So if you are to do that, they will be queued into that queue location. I can't do that with this particular patient here because it will tell me that they are already in some queue. So I'll not want us to test our EMR beyond its capabilities. So allow me to move to just go back again to service queues and probably mention one thing that I didn't probably get to mention. Yeah, so when I was talking about the queue screen, this is what I was talking about. So with a proper configuration, if you can avail TV screens, so this information will be broadcasted in the different waiting areas. So as you can see, there is like a CLI, probably talking about clinician room. This is a ticket number that has been issued to that particular client. So they'll only be looking out for this. And I'm sure this is one feature that can really come in handy to help resolve issues of patients complaining that they have been in the facility for too long. And again, we are Africans, and we know that sometimes we go to health facilities and we look out for our relatives and ask them to help us just fast track our service. So which is, something that can be curbed with the full utilization of this particular feature that you've enhanced in the EMR. All right, so allow me to go to the second part of my presentation today, and I'll learn to look at appointments. Again, like I said, also lumped under patient services. And again, a very good, robust feature here. One thing that I'll want to mention from the onset is that initially appointments were being filled from the clinical encounter forms. And those who have been who have been utilizing KenyaEMR for a long time will tell you that again, we used to only give appointments to patients that are receiving HIV care and treatment. That is through the green card. But now there's this one that we've introduced, and actually now it is called the centralized appointment management. So this one takes care of each and every patient or client that is receiving services within that particular health facility. And again, when you just click on it, one thing that you are able to see is that the appointment metrics, very good. You can even be able to tell how many patients you're expecting on that day. And I think this is a very important tool for managers, again, not only just the caregivers, but also the managers, that they can tell, just at a glance, what is the workload for the facility on that day, so that this can also advise on the way they can redistribute, let's say, their workforce. So as you can see for mine, there are about 27 patients that have been scheduled for today. 4 have already been checked in. 23 have not yet arrived. So as you again remember, this is just a test instance. So you don't expect all of them to have arrived. So it's just based on what you are doing currently, and then it can even tell you the highest volume service today, which is the MCH postnatal, where 6 patients or 6 clients are expected. And the providers that have been booked today, again, about 7. So it can even tell you the workforce that is supposed to attend to this. So it's one good thing that we'll want we'll encourage facilities to start utilizing, especially those that are going hospital-wide. We will also probably be looking forward to getting feedback from those that are already using it on areas of improvement. But as is, I think it's a good, it's a very good enhancement. So below it, as you can see, you can also filter down and go by the 3 different filters. But our filters here are appearing in the form of tabs. You can see now there is expected. So the expected are the 27. When I click on checked in, I'll get a line list of the 4. So when I was here, I had a list of about 27 individuals. So when I came to checked in, there were 4. And then now you can also tell those that have completed their visit, those that have already been attended to. Currently, because you have not done any clinical encounter, so I don't have a list to populate. So one good thing about it again is that other than just the display, you can come here on the right side of your screen and just download the list, whether it's for checked in, and then it will give you a downloadable Excel sheet. As you can see, I'll not want to go there, but it just gives you a line list of all these patients, and then you can utilize it the way you want. So other than that, what else do we have here? You can also create a new appointment from here. So there are 3 places where we can create a new appointment from. One of them is what you are seeing on the right side of the screen, but it all leads to the same thing. Eh? So once you click on it, for this one, it's where you are supposed to search. Let me try and search a patient here or a client. Mary, and then I search. So you're able to just quickly search, and once you get your client, probably I'll want to give Mary an appointment. You'll realize that the appointment form actually is standard across even the forms, the clinical encounter forms, and even wherever, no matter where you pick it from, it will always look like this. So I can come and say that I'll want them to come probably for MCH antenatal services, and this is as a scheduled appointment. The recurring appointment button is actually recommended for use where you just want the appointment to be recurring, like let's say on a daily basis. Daily basis, why? Because there are patients that we usually put on directly or observed therapy. I used to see that, especially in the TB programming. Or probably there's a patient that you want to be coming for daily, for a daily syringe or something like that, injection. So yeah, you can do that. But our normal patients, those that clients that just come probably, and you want to attend to them between 8 and 5, we encourage the use of this button here all day, so that you just go ahead and give them the appointment that you want. And using this feature here, I can toggle and go to the month. Probably if I want to give them an appointment next month, today being the 24th, and on a Thursday, lands on the 22nd. So I'll have scheduled them for 22nd. And I'm sure the date helper helps a lot in just being able to move. So you don't have to really type. And then now I just come and save that. So that appointment has been scheduled. So that I've scheduled an appointment for the 22nd. So that is one place where you can do, you can actually create an appointment from. But before I go to the other 2, allow me to also show what the appointment calendar here does. So the appointment calendar, again, a very good feature that is supposed to help managers and facility administrators, and also the caregivers, just to be able to distribute their work equitably. I'm sure all of us have been to facilities where you find that on one day there are, especially clinics where clients walk in based on appointments, you find that there are, on one day there are like 10 clients, and then the next day people are dying because actually the caregivers are dying because there is a very big workload. So there are 70, and yesterday we only had 10. So this one will help in helping them distribute, because now with the calendar, you're able even to know, even before you book, how many patients am I expecting. Like for my case, if I'm to go to 22nd November, May, where I gave my patient, you can see there's one that has added to MCH antenatal, and that's the only patient that I added. And then there's one has been scheduled for cervical cancer screening, and there's only one again dental appointment. So this is a very powerful tool that we are actually encouraging facilities to utilize, just to be able to spread their workload and service their clients efficiently. Because one thing we understand is that if you are to be swamped up with clients outside your door as a caregiver, sometimes, as a healthcare worker, most of the times you tend to just push the queue. So this one will really help us in just being able to manage our the workloads and the way we attend to our patients overall. So the other place that you can also again book you can also make document an appointment is when I come down to, let's say, to the patient level, and as you can see, if you are to look at on the left side menu, there is appointments. So I can come here again, click on appointments, and then one feature that has been added is the add appointment feature. But other than just that, you can also be able to see any upcoming appointments if there were, and also see if they had an appointment today. So by clicking here again, it gives me the same form that I filled. So I won't fill this one. It's just the same form, and they all contribute to the same pool. So they will all be taken to the central appointment management feature. Right. I think with that, I'll want to go to the other feature that we were supposed to showcase today, and allow me to quickly go to the referral features. And when looking at this, the feature has been available even in 2.x, but the earlier beneficiaries of these were clinics that were offering HIV care and treatment. And then now, when with the directive of the country adopting universal health coverage, and also the adopting of the smart PCNs, primary care networks, we found it prudent to just also include these in the EMR. So as you can see, the referral features enables us as a facility to be able to pool even referrals that have been made from the community. But this is the catch here is that there must be some configuration to map the various we call them healthcare, the healthcare workers that have been mapped to a specific probably spoke, or is it whether it's a spoke or a hub to this particular facility, so that when they make their referrals, the facility's EMR is linked to the ECHIS system, and then it only pulls those particular referrals that have been made to that particular facility. So as you can see now, again divided into 3 segments. That is from community, strictly those that are being pulled from ECHIS, and then from facility. Facility now again, we are talking of current cases of HIV programming, where we are able to, once I transfer a patient, I should be able to see them even before they get here. I should be able to even get their information. So that one also works. But looking at the bigger picture and looking at where we are heading to, us going hospital-wide, I'm sure this is also one feature that we'll be able to probably just utilize to be able to exchange information between or information on patients between facilities. But I'm sure there's also a catch to that, and that's the reason why I'll not want to talk about that here. So I'll look at that under the SHR portal. But currently for HIV clients, we can still be able to see their movements from here. And then the pool referrals feature, when you click on it, if this was had to be configured, if this was configured, you will be able to probably see a list of referrals that have been made to this particular facility, and also those that have been completed. So for the referrals, this particular bit is that's all I want to talk about. It's kind of straightforward, so it doesn't have too many nitty-gritties. But with the new direction that you're taking, again, like I mentioned, I'll want to utilize a patient here called Patricia Barbara Hernandez. One of the features that we have enhanced the EMR with is the SHR portal. SHR actually in full actually is this shareable health record, and it is one of the requirements by the Digital Health Agency to any HIS provider that going forward the EMR must be in a position just to be able to share critical health information about the patients that they attend to. And how do they share this? It's through again the health information exchange, just like Ajuanga was showcasing. So the shareable health portal enables us to share information about a patient. And what does this do? What is the value proposition of this? Just helps in reducing the diagnostic time of for patients, especially with those with life-threatening conditions. I'm sure most of us have come across patients who have lost their lives just because the duration between their diagnosis, the true diagnosis being revealed and the time they started seeking for treatment has been long. Probably they started off from a dispensary where they were asked to go and do a sputum. It was discovered it wasn't TB. They went to another health center. The information from the dispensary wasn't shared with the health center. So it took a very long time, and even sometimes they even had to repeat tests that have been done in the lower facilities. Now with the SHR, this is going to be a thing of the past, because all that we are supposed to do is, as long as the EMR has conformed to this, you're supposed to be in a position to be able just to pull SHR record for a specific patient now. So this is patient specific, and as you can see, one of the things that has to be met again by that particular patient or even the facility is that you just can't pull anyone else records. They must authorize for you to get that record, and that's the reason why when I clicked on pull SHR records, there are these three features that you're able to see here. So there was a one-time password, there was a PIN and biometrics. So that particular patient is supposed to provide, if you are to pull my records, assuming that I was seen in a facility in Kirinyaga last week, and you are to pull my records in Kisumu, probably all that I'll need to do is to give the one-time password that will be sent to my phone for the facility to make use of that particular in a health record. So you can't use this to because I'm sure people might think one question that I usually ask is, is in this putting patient records at risk, because I can know your ID number, and then I'll try and just find your information from anywhere else. No, you can't get my information without me giving you the OTP number or without me providing a PIN for those who will not be having phones. And going forward, there will also be need for us to utilize biometrics. I'm sure this is for the benefit of those people who do not have either a PIN or a phone. So this is one feature that has also been enhanced, and it's one feature that we are really hoping that will come in handy and help just be able to ensure that the time between diagnostic, like I said, to the time between reporting to the facility and the diagnostic has been reduced for all of us, so that we can help save more lives. Right, allow me to discard this. I'm also supposed to take you through the last feature of the day, and I'll be taking us through the administration feature and also the new ETL feature for KenyaEMR. So those who have been in this field for long know that we used to go to the 2.x side to just be able to probably recreate our tables before we can generate our reports at the end of the month, or even before we can upload data to the National Data Warehouse. But now with 3.x, there is this administration menu that has been added under the application menus. So you click on it, it takes you to user management. So as you can see, it comes in with the 3 very important menu items. One of them is manage users. So again, we used to go to 2.x to create new users. So this particular menu item will enable facilities to just be able to manage the account creation activities for their different healthcare providers. So if there are new providers, this is where you come to, and you're able to just create them. And probably if there are providers that have been transferred or they have retired, this is also where you come and disable them. So by clicking on manage users, you can see there's a list of users that have been set for this particular instance. But if I'm to add a new user, I just click here on add new user. And then I'm supposed to provide all this information. Remember, with the new regulations again on UHC, and also for SHA to be effective, one other thing that we all have to adhere to is the availing of the various licensing numbers for the different cadres. So for example, if you are a nurse, I mean, you'll be required to provide your nursing council license number. If you are a clinician, a clinical officer, your COC registration number, and then for all those who fall under the KMPDU, again, that will also be a mandatory. So for you to be enrolled as a user, all that will have to be given here, and then as you can see, your national ID and then identifier. So all that will have to be provided. Either you're using a registration number, so. And then if you're utilizing a registration number, you still can be able to search. And this feature is also linked to the HIE. So if I had a registration number for one individual, I should be able to just be able to pull and get their details as is from the HIE, from the Health Information Exchange. So the Health Information Exchange has actually been linked to all these actually is also being furnished with the information from all these registration bodies on a daily basis, or I think on even not a daily basis, very routinely, probably after every 15 minutes, because there usually changes to the register to the role. So that's what you're supposed to do, and then provide all the details before we can and admit you as a user. Right. The other thing that has also been added in here is the ETL administration. Like I mentioned, it used to take a long, all of us used to go to 2.x to be able just to refresh tables, refresh the UAPI tables, recreate tables, and also recreate data tools. So all these have been brought here. So you really don't have to go back to 2.x to be able to do this. So the end goal and the end game of this all is that we are looking forward to a day where even our reports will be in 3.x, so that you don't have to go back, so that we can comfortably retire the 2.x interface. So this is just some progress that has been made, and which I thought I should highlight today. So those who are already running this, please try utilizing this. I'm sure probably some of you have not known that this is existing. So this was a very good place to also, a very good feature for me to mention. And then lastly, the facility details. This is very important because for any facility to be accredited with SHA, this is where you will be able to come and update your information and then just do the synchronization. So if you are if your facility is to be probably receiving rebates and stuff, or make claims to SHA, this is where you will need to go. But again, this is meant for the system admin, so I'll not want to dwell on it so much. Allow me to probably pause there and hand it back to Songok for the Q&A. I think that marks the end of this.
All right, thank you. Thank you very much, Moses, for taking us through that last part, and of course, appreciations to Bernard Ajwang for taking us through the first part, focusing on the introduction to the new features in KenyaEMR3.x, and taking us through a demo, looking at the general overview, and some basic navigation features that we need to adhere to, especially when searching for a client or when you're performing your registration, and of course sharing with us some of the features that have been enhanced to improve the patient profile, and of course taking us through the clinical menu and the other care panels and the special clinics panels that have been enhanced within KenyaEMR3.x. Of course, Moses took us again, just picking up from where Joang left, to just show us some of those special features that have been enhanced, looking at the service queues, the appointment management, the patient referral, and summing it up with, or crowning it up with, the ETL process, which aids in terms of a reporting purposes. So at this point, I want to open it up for Q&A. Thanks, team, for being available to respond to the questions on the chat. I think I've seen some questions that have been responded to, Adeline, Marianne, Frida, Moses, and Ajwang and Otieno. And I think Ogutu also, you've been able to post the toll-free lines and the email addresses. Of course, this conversation may not end here. Of course, the team will be available to respond to any other issue that you may run into in your facilities in the process of providing your services. Diana, I've seen your hand is up. I don't know whether you have a question you want to ask at this point, because that's the next step, or you want to make a comment. Maybe, Otieno, you can give the mic to Diana. Yeah, Diana, you can unmute and go ahead. Yeah. So meanwhile, I was just running through the chat to see whether, because I really don't want to repeat reading through the questions that have already been responded to, but in case I miss any that has not been responded to, you're still free to ask. We still have a few minutes that we've spared for Q&A before we close. Yeah, I can say, I think there are questions here from, I can start from, there's one question from Peter Njoka from Komani. Is asking for some clarification on the setup process that's required for referrals. And then there's a question from Anthony. Why can't it be mandatory for all clients to be registered under SHA so as to enable them to enable them be seen in different facilities using the SHA number? I don't know that these have been responded to. I need to just quickly, I think the team has responded to most of those questions. So please allow me not to read through. I'm just looking for any that has not been responded. Sorry. I think Peter again is asking the experiencing challenges accessing the care panels to edit patient registration details. Is there a permanent fix to this? I'm not sure whether that has been responded to. Probably if not, then maybe Bernard Ajwang or Moses can respond to that. I don't know whether Andrine is in the call. Maybe she can also be able to respond, or anyone from QA who can be able to respond to those questions that have been raised regarding the bug fixes We are also having challenges checking out class. Same question from, there's another question from Peter. So I don't know, Ajuang, are there any questions that are pending? I may not want to read through all of them. Are there any questions that are pending? I know you may have run through the chat wall, and I don't know whether you've picked out any question that has not been responded to. You can quickly comment as we allow any hands up to be responded to. Maybe, Ajuang, any comments?
Yeah, thanks, Ngok. I don't see much. I think the last set of questions are the ones that probably we might want to respond to. Let me just see.
Yeah, there's a question from Mike from Kakamega. I think he had challenges with his mic, the CHRA Kakamega. He has a concern with the inpatient services. So I don't know what exactly that means, but maybe you can just preempt, or you can just comment.
All right. So I think I just wanted to comment, just a comment. I know Eric has also been responding to some of the issues. A number of the issues that some that need QA verification, I think Eric has commented that you'd want to verify those with the QA. Where there are errors. I think what I wanted to request Eric to respond to is there's a question here around checking out, that you are unable to check someone out until they've stayed at the facility for more than 10 minutes. So maybe Eric can respond to that if that was a design feature, so that you do not say someone has checked in, has had full services within your facility for under 10 minutes. Is that by design? And there was a question also around whether we are allowed to delete lab results without starting a new visit. I would request Eric to respond to those two, as we probably can get more details around the CHRIO Kakamega on what exactly is the concern on the inpatient services module.
Okay, thanks. And I think also Eric, and thanks Eric. I think I hadn't seen your responses. Thanks so much for also being available to respond. Also, you can respond on this question from Kennedy Odhiambo. Is asking, are we able to check a daily workload summary? In the past, we were able to click on the calendar, and we were able to check clients who were seen on the past dates. So probably you can respond to the two mentioned by Ajuang, and then this one from Kennedy. Then meanwhile, Otieno, you can give the mic to William Opar. I think his hand is up. Diana, I think we'll come back to you. I don't know if you're able to unmute now, but maybe Eric, you can go first. Eric Mudomi. As I also look at the Q&A section, I think someone has pointed that there are questions there. So the team, we can also look at the Q&A session. There are some questions there that have been raised. We can also respond to. Eric, I don't know.
Thank you, Somkok, and thank you, Ajuang, and again, thank you, Moses, for the training.
Franklin, oh, sorry. What's it, Eric?
It's okay. So let me respond to the first question on checking out, which takes time, maybe 10 plus. I may not be having a right answer to that because we may not want to know those users experiencing the same, so that even our quality assurance team can be able to reach out and be able to investigate the reason as to why it is taking 10 minutes afterwards. It's not by design, maybe Ajuang and the team. So I would like to know what is causing that. So I would urge the user who is getting that can be able to reach out so that you can be able to look at it. Then there was a question on deleting lab results without starting a new visit. We would like to know the use case. Why would we want to delete that lab results so that we can be able to guide on how we can go about it. But now we would like to know why would we want to delete that lab results. We know some of these data pertaining to a patient may be, we may want to handle it with great care. So we'd like to know the use case. Why would you want to delete that particular lab results? And then we can be able to guide on that. I think the last question. Let me engage Kennedy Odhiambo on the chat so that he can be able to understand very well what you are talking about on the daily workload summary. There before I thought you were talking about the M717, but I think it seems to be something different. So maybe Songkok, allow me to engage Kennedy Odhiambo on the chat on that
No
particular
problem.
question.
I think that's very much in order. That's very much in order, Eric, so that you can understand the context. So if it was monthly report, I think that would be slightly different. But I think what he's talking about is whether you are able to get your daily workload, and in this case, like the close of the day, are you able to tell how many clients you've been able to serve, probably as per the service delivery point or as a facility. Moses, I can see you are unmuted at some point. You wanted to make a comment?
Yes. I saw there's a question by Njoka. I think that wasn't answered. Kindly clarify on the setup required for the referrals to work. I think he was talking about the community referrals, the one from the community. So yeah, Njoka, for that to happen, there must be collaboration between us and Medic Mobile. Medic Mobile is the team that is handling the Ichis platform. But there are some configurations that have to be done to the EMR, and then we must get just a window from the Ichis team to be able to remember. You're only supposed to see the referrals that are coming to your facility, and not all. So that's the reason why there must be collaboration between the two of us. But this can be liaised. You can liaise this with each county has a PCN coordinator. They can help you get this, and then now you come to us. We should be able to allow you be able to get that. I think that's what I wanted to comment on.
Thanks, Moses, for your comment and the additions. So I think at this point, I want to probably allow William Opar and Caleb. I know, Caleb, you've already posted your questions on the Q&A, and Eric has already responded to some of them. I don't know, probably maybe you still have a follow-up question on the same, but I think Eric has attempted to respond to the questions that you've already posted on the Q&A session. William Opar, you can go ahead.
Okay, thank you so much, the Palladium team and everyone. My question is in line with patient management under HTS. So as at now, the HTS guidelines stipulate that we test mothers at PMTCT with standard EQ, and the same applies when they come as a couple. If you want to test the husband and the wife, we are supposed to use the standard EQ. But now, if you go to the system to do your entry, if you try enter the man with the standard Q test kit, so you realize the standard Q test kit doesn't appear as the screening test. So it brings a challenge onto entering the husband into the EMR because the standard Q doesn't appear. So that is challenge number one. Challenge number two was with assigning NUPI at OPD. You realize the number of sites always work offline. Then they would want to push when they already indicated the IDs. When they connect the internet, they would want now to push the client to post the client to registry. So when you try posting, you realize it brings some error that does not allow the client, you to generate the NUPI number. So if you look at that client on the dashboard, you'll be seeing the details plus the ID number, but you cannot post to registry. So this client will stay without a NUPI number for as long as that error is still coming. So those are the two key things that I wanted to ask to get assistance. Thank you so much.
All right, thank you, William. We can take one more from Caleb, then we respond to them. Caleb.
Thanks, team. My concern, apart from what I asked in the Q&A section, I have a concern on the lab manifest. Currently, sometimes we normally have power challenges, and maybe for a day, and some of the VL requests are done maybe for today, and it forced me to key them in tomorrow. Is when I post them under lab manifest. But the system does not allow me to use the date for today if I'm posting maybe tomorrow. So I was asking how we can get maybe the date for today. If the VL was drawn today and I because of power challenges, I need to push them tomorrow. How is the quality of date going to affect this? And how can we help this in terms of system management? Then I did not get a clear answer about my concern in the Q&A section. Concern load. Thank you. You can, if it has been responded to, I hope you can help me or repeat for me to understand well.
Thanks, Caleb. I don't know whether it's my network or your network because you kept breaking. So I'm hoping that the team has gotten your question. But I think I got the first part, the lab manifest.
Yes, okay.
I think so. What you're asking is whether you can be able to backdate. I know the system most of the times doesn't allow you to backdate, but we can we'll discuss and see how best to handle such, because the best way would be the date that will be captured, the day you're entering the sample is the automatic date that the sample was entered. But you're talking about a situation where the sample was drawn the previous day, and probably because of issues around power, so you are not able to access the system, and you are now posting the sample into the system the following day. So what happens in that case? So probably maybe we can discuss and see how best to handle such. Yeah, so I think the first two questions, it was related to standard queue, and I think this was in. You can just mute, Karen, please.
There were some concerns again on under orders, lab orders and results. My first question was, can we be allowed to edit in case where one might have given a wrong reason for VL requests, especially for pregnant and breastfeeding mothers? Then for some mothers who are already enrolled under PNC and still flagged as pregnant. So I did not get a clear response about that, please.
Yeah, so maybe I'll request Eric to just check on the Q&A, because those two questions you're asking, you already posted on Q&A, so that the team should be able to respond to that. But before you go there, Eric, I think this first question from Caleb is directed to you, and this is related to HTS, because I know within the HTS register, I know we've not given as one. And I mean, the kits that are listed there, standard queue, I know is not one of them, and probably that's the reason why, Caleb, you're facing that challenge, because standard queue, I think, appears only in the PMCTC tool, that's the ANC register. But I think Eric can probably just speak about that. And then the issues around NOPI, I don't know whether it's Moses who can respond to that. And then I think, Moses, you can also respond to the question on the lab manifest. Maybe we can respond to that, and then we take two more before we close. Eric, you can go first.
Thank you, Songok. On the issue of standard queue, there is a time we never had that test kit. our forms, but we've included it. Maybe the question to the person who asked about the standard queue, did the person mean that they use under the the MCH forms or under the HTS forms? Maybe that's some clarity I would want to get.
It's under, I think it's under the HTS forms, because he was referring to the spouse. So clearly it means the client who accompanies the woman, just allow me to use that, to the clinic. So if they come as a couple, practically, the understanding is that for the man will be captured in the HTS register, and the lady will be captured in the NC register. So I think Caleb's question was in reference to the spouse, the man accompanying the lady who's come to the ANC clinic. And you can also correct me, Caleb, if I didn't get your question correctly.
Maybe I can clarify.
Mm-hmm.
Yeah, what I mean is you see the guideline says that if they come as a couple, you test them as a couple using one test device, which is a standard queue, which screens both HIV and HIV and syphilis. So when you go entering in this month into the EMR, when you go to the that place for test kits, if you click for the screening test, you will not see standard queue. Instead, you will see twin screen. But again, this man should be entered as done for screening with standard queue.
William,
Yes.
we get that clearly. That process is very clear, but we're talking about, I think the question is in relation to documentation. So you're asking in relation to documenting in the HTS form or the ANC form?
In the HTS form.
Correct, yes. And I got that correct. That's what I understood. And I think probably maybe Eric, you got that now?
It's okay, Songkok. Okay. We'll look at on that particular section. I know for the HTS forms for the females, they'll be able to see that. We will enable the standard queue for even the males. Thank you.
Okay, so thanks. Moses, you can respond to the two questions on NUPI and the lab manifest.
Well, so look, I think I'm not the right person to even respond about NOPI, but because a statement has to come from somewhere. Anyway, for now, we are looking at actually even just going all the way to utilizing a new identifier, and that's the reason why I'll not want. Like I said again, I'm not the right person to make that statement. Let us wait for direction from either the Digital Health Agency on the future or of NUPI, or or probably whether we're going to have its replacement. So I'll skip that one. As pertains to the second question on lab manifest, probably what we might want to look at is just the schedulers that have been set in that particular facility. Most of the times, the issues that we come across with facilities is actually stem from the way the schedulers have been set. So I'll request my brother to probably just reach out to through our service desk so that we can be able to just interrogate the way the schedulers have been set for that particular facility.
Thank you, Moses. Thank you, Moses. Paul, I put you on the spot on the NUPI issue. I think I should have actually responded to that in the initial stage, that there are some restructuring that is currently going on. And once that is done, we should be able to probably just give you more direction on issues around assigning identification or patient identification numbers within our systems. So that's work in progress. We'll be able to communicate, and maybe I'll request Diana To to maybe comment probably when she will be making her remarks towards the end of this particular session. So I think I can take two more and then we close. So we have Emmanuel and then Kennedy, keep to him. So Emmanuel, you can go first. Emmanuel, you already have the mic, or if Emmanuel is not able to speak, then we can go to Kennedy.
Okay, thank you. As Emmanuel is trying to search for the mic, my name is Kennedy, and I'm really learning a lot from this platform. But I only have 2 questions. That is on the appointment matrix. One, the number of the appointments. You haven't discussed on the duplicate, because one, we have a majority of our clients being seen as duplicate. 2, when you have even already checked all the clients out, at the end of the day, when you click on the complete, you cannot see how many have been completed. So when you want to see how many of our clients that came in and were checked in and completed, and then remain with those who missed, that really didn't come, we cannot get that list. Because if you try to do a report on those missed, especially on the appointment scheduled for that day, you find that it gives you a different number as compared to the one that is on the dashboard. So I don't know if that has been sorted out, and can we speak about that? Maybe it can help us, because at least most of the time we want to rely on the dashboard to see how many of our clients were booked, how many checked in, how many completed, and how many missed. So kindly, thank you.
Okay, thanks, Kennedy. Emmanuel, I don't know that you're able to speak now. It seems like Emmanuel doesn't have the mic. I think I've noticed that. Otieno, are you able to enable Emmanuel? Yes, now it's okay. Emmanuel, you can now unmute.
Yeah, thank you so much, Mr. Songok and the Palladium team for organizing for us the session. So I only had one concern under HTS, and that is specifically under contact line listing. So you find that under relationship, we now have 2 features whereby we can either add a family member or a PNS client, or we can create. So you find that in scenarios whereby we need to use add, we only add a client whom has already been registered in EMR. But in a scenario whereby the contact whom was being line listed doesn't exist in EMR, the providers are supposed to click on create, so that that client will now be line listed under the index client. So you find that this option for creating this contact, once you feed into the details of the contact and you want to submit the form doesn't submit successfully. So you find that this is hindering contact line listing on our end. So I was requesting if probably we are able to get an assistance so that we can continue doing contact line listing using EMR. So that's the only question that I had. Back to you, Mr. Songok.
Okay. Thank you, Emmanuel. Diana, I think Diana doesn't have the mic also, but maybe you can. Yeah, now she has. Diana, you can go ahead and mute and ask your question. I know you were the first one to raise your hand. I don't know that you still want to speak. All right. Yeah, I think we can go ahead and summarize. So maybe Moses, you can respond to the question around appointments. Then I don't know if Kezia or Eric. Maybe Eric, you can respond on the question around the contact listing relationship. I didn't get quite understand what Emmanuel was asking, but I hope you got the context of the question. Maybe Moses, you can go first on the appointments, then Eric and Tim can respond on the line listing.
Sure, thanks, Franklin. And I think, we've gotten that concern. I think we'll review it in-house and then probably provide a solution ASAP. But probably if Eric will also want to, or Eric or Kezia will also want to just make a comment on the same, I'll request that they also do.
Okay, so thanks, Eric.
Thank you. Let me respond to the contact listing. The one that Moses has just mentioned, I think maybe Kezia, you've captured it. Imenipita kidogo. So even as we were talking, was even trying to see whether that form does not submit, but from my end, the form submits using the same instant that Moses used to do the demonstration. So I would urge the person who asked about the contact listing, whereby you use the create patient option, not saving, you can try. The only thing that I know, and we make the corrections on this particular section on the create patient, is whereby it was mandatory for you to give the 3 names, and that was corrected. You could notice that if you are giving only 1 name or 2 names only, the form could not even save. But that was, we relaxed the middle name as it has been within the KenyaEMR, so that the form can be able to save. Again, you can try with our U8 instance and see the same is saving. But if from your end, maybe at the facility level, the form is not saving, kindly reach out to our service desk so that we can be able to help you and ensure that the form is saving successfully. Kezia, I don't know whether you got what Moses talked about.
It was a concern about the appointments, that they are not able to go back and be able to just find out the number of patients that they had. But I think that is in retrospect. They can only do it on that specific day. So it's something that I said we'll look at it in-house, probably provide a feedback.
Okay. All right. Thanks. So maybe Emmanuel, you can reach out to service desk so that they can be able to assist you and probably sort out the issue you have regarding the contact line list. Kennedy, I think you can also probably reach out to the service desk team so that they can probably just get to understand your concern and help to sort it out. Diana, let's have one last one from Diana, because I know your hand has been up quickly. Diana, because we are 3 minutes to the top of the hour. All right, I think it seems Diana has challenges with the mic, because she has the mic right now, but apparently it seems like she can't speak. So I'd urge the team to keep consulting the service desk team. I think Ogutu has already posted our the toll-free line. You can always reach out to the team. They'll be on standby, of course, working hours. They'll be on standby to support where needed. On areas probably where they're not able to respond immediately, I think there is also room for consultation, and we will always be able to provide feedback at any one given time. So at this point, I think we have come to the end of our our 4th virtual training session. We're looking forward to the next one coming up. I know next week, Thursday, is holiday, so we'll be able to communicate to you on, because we may need to reschedule the one that was lined up for Thursday next week. Otieno, confirm, Thursday next week is on 1st, right?
Yeah, we have the next session on 8th, the week after next.
So the next session will be on 8th, so that is the other week. Otherwise, everybody feel appreciated. We really appreciate you for creating time to attend this session. Before I close, I want to request, I don't know that Diana Tong from Palladium is still in the call. I think I'd seen her join. And then I'll also want to give an opportunity to Mike Ruto, the CHRIO from Kakamega. I know he was to make some remarks at the beginning, but unfortunately he had challenges with the mic, so I'm hoping he's able to speak right now. But before we go to Mike, maybe we can start with Diana. Diana, I don't know that you're still in the call. Okay, it seems like seems like Diana Toss dropped. Mike Ruto from Kakamega. I don't know if he's still in the call also. Okay. Seems like he also dropped. All right, so I think we can then end it at this point. thank you very much from our end. Like I said, we really appreciate the support that we keep receiving from your end. We also appreciate the fact that you're able to create time to attend this session. We are looking forward to engaging with you further through the toll-free line. And of course, we are looking forward to interacting with you in our upcoming sessions. So otherwise, from my end and on behalf of the NASCOP SI team and the NASCOP fraternity, let me take this opportunity to say thank you very much. Have a blessed evening. Bye, and let's meet again virtually next on 8th. That is the week after next week. Thank you very much, and bye.
Bye.
Bye-bye.